Stop trying every piece of conventional advice, elevating your legs, soaking your feet, cutting salt drastically while the swelling just keeps coming back. I'm not talking about a little puffiness after a long flight. I'm talking about legs that feel heavy as stone, skin stretched so tight it's hard to move, and deep, lingering dents left behind when you take off your socks. The hallmark of pitting edema. Is that the reality you're facing every evening? If so, listen carefully, because this serious fluid buildup isn't just discomfort. It's a red warning signal that your circulatory system is in trouble. When fluid pools persistently in your lower legs, gravity is winning, slowing your blood flow to a near standstill. This condition is called venous stasis, and it's the perfect environment for dangerous, potentially life-threatening blood clots to form, known as deep vein thrombosis. This isn't a cosmetic issue. This is a serious circulatory health problem. And the reason conventional advice doesn't work, because it only treats the surface symptoms. You're missing a nighttime protocol, one that doesn't just manage fluid, but actively reverses the buildup while you sleep. I'm Ethan Palmer, a cardiothoracic surgeon with 15 years of experience, and I need to confess something. After 15 years of standing in the operating room, surgeries lasting 6 to 8, sometimes 10 hours straight, my legs started sending signals I couldn't ignore. Not severe swelling, not yet, but that heavy feeling at the end of the day, and sometimes a tightness around my ankles when I took off my shoes. I realized if I don't act now, I'll become my own patient in 10 years. So I started experimenting, not in theory, but on myself. I tried dozens of methods. Compression socks at various pressure levels, different massage techniques, leg elevation at multiple angles, supplements marketed as miraculous, different timing water intake throughout the day. Some did nothing. Some made things worse. I once woke up 4 times a night to urinate just because I elevated my legs the wrong way. Most were completely useless, but 5 methods, just 5, made a significant difference. Not gradually, not over months, but in a way I could feel within the first week. Lighter legs, shoes fitting more comfortably, and most importantly, without trading it for waking up in the middle of the night to use the bathroom. After that, I applied and refined this protocol for thousands of elderly patients. The results were consistent: reduced swelling, addressing the root cause, and no recurrence. In this video, I'll share exactly those 5 steps, the complete nighttime protocol that drains excess fluid while you sleep. But there's more. I'll also reveal common prescription medications that are silently causing your swelling. Medications that even the doctor who prescribed them may not have mentioned this side effect. In step number 5, I almost skipped it during my experimentation, but in the end, it made the biggest difference of all. When you wake up, your feet will be flat, flexible, and comfortable enough to slip right into your favorite shoes. Stay with me until the end of this video, because missing one small detail could make the difference between solving the problem completely and ending up in the emergency room. But before we dive into the 5 specific steps, I need you to understand something important. Not all leg swelling is the same, and how you treat it depends entirely on what's causing it. There are 5 main types of leg edema, and identifying which one you have will determine whether this protocol works for you or whether you need to see a doctor immediately. Type number 1, gravity edema. This is the most common type in people over 60, and also the easiest to treat. The cause is simple: sitting or standing for too long. Gravity pulls fluid down into your feet and ankles, while your circulatory system isn't strong enough to pump it back up efficiently. How do you recognize it? Swelling gets worse by the end of the day, improves by morning after lying down all night, and affects both legs equally. Type number 2, venous insufficiency. This is when the one-way valves in your leg veins, the valves responsible for preventing blood from flowing backward, become damaged or weakened. Blood pools in your lower legs, causing swelling, aching, and often visible varicose veins or skin discoloration. How do you recognize it? Swelling is usually worse in one leg, accompanied by a heavy or tired feeling, and there may be darkened skin around your ankles. If you have venous insufficiency, simply elevating your legs won't solve the problem completely. You need compression socks and specific exercises that I'll describe. Type number 3, lymphedema. This is swelling caused by a damaged or overloaded lymphatic system. Your lymphatic vessels normally drain excess fluid from tissues, but when they're not working properly, protein-rich fluid accumulates. Lymphedema feels different. The skin is tight and thick, and when you press on it, the dent doesn't bounce back quickly. It usually starts in the feet and gradually spreads up to the lower legs. If you've ever had lymph node removal surgery, radiation therapy, or a severe infection, you're at higher risk for this type. Type number 4, medication-induced edema. This is the type I'll discuss in more detail later in the video because it's important and often overlooked. Dozens of common medications cause water retention as a side effect. Blood pressure medications in the calcium channel blocker family, like amlodipine, are the most notorious culprits. Non-steroidal anti-inflammatory drugs like ibuprofen, corticosteroids, some diabetes medications, hormone replacement therapy. How do you recognize it? Swelling starts or increases significantly within a few weeks of starting a new medication. And here's the important thing. If medication is the cause, no amount of leg elevation or compression socks will solve it completely. The solution is talking to your doctor about medications. Type number 5, heart or kidney-related edema. This is the most serious type. When your heart isn't pumping efficiently or your kidneys aren't filtering properly, your body retains large amounts of fluid. Swelling usually affects both legs equally, extends above the ankles to the calves or even thighs, and comes with other symptoms like shortness of breath, fatigue, or decreased urination. If you have this type, you need medical treatment right away, not just a nighttime protocol. Now let's do a simple test to roughly identify your type of edema. Sit down and press your thumb firmly into the front of your shin bone for 10 seconds. Release and observe the dent. If the dent stays visible for more than 10 seconds before the skin bounces back, you have pitting edema, the type that responds well to the protocol I'm about to share. If the skin feels firm and the dent doesn't form clearly, you may have lymphedema, which requires more specialized treatment. Now look at both legs. Is the swelling equal on both sides? If yes, it's likely gravity edema, medication-induced edema. If one leg is significantly more swollen, it's likely venous insufficiency, or more concerning, it could be a blood clot. Finally, think about timing. Does the swelling get worse during the day and improve overnight? That's gravity edema, or venous insufficiency. Does the swelling stay the same or even get worse overnight? That's a more concerning sign, possibly related to your heart or kidneys. I have a more detailed video on how to self-assess your circulatory health on this channel. If you want to go deeper, look for it after this. Now let's dive into the 5 specific steps. The nighttime protocol that drains excess fluid while you sleep. I'll go from the foundational step to the one that makes the biggest difference. Step 1, strategic hydration. I know this sounds contradictory. Your legs are holding too much fluid, so why talk about drinking water? But this is exactly the mistake so many people make. They think drinking less water will reduce swelling. It's the complete opposite. When your body is dehydrated, it switches into conservation mode. Your kidneys reduce urine production. Your body releases hormones that make you retain sodium and water, and the swelling gets worse, not better. Proper hydration, paradoxically, actually helps reduce edema by allowing your kidneys to function normally and flush out excess fluid. The secret is in the timing, not the amount. Drink most of your water between waking up and 5 o'clock in the afternoon. 8 to 10 glasses spread evenly throughout the day. After 5 o'clock, reduce significantly. A small glass with dinner, a few sips if you're thirsty in the evening, and stop drinking completely 2 hours before bed, except for a few sips to take medication if needed. Why does timing matter so much? When you drink water, it doesn't leave your body immediately. Your kidneys need time to filter it, and when you lie down, your body becomes less efficient at moving large volumes of fluid. Drinking a lot of water right before bed ensures that fluid will simply settle by gravity into your lower limbs. By stopping 2 hours before bed, you give your kidneys enough time to complete the final fluid regulation while you're still sitting or standing when gravity supports blood circulation returning to your heart. I've mentioned this principle in previous videos, but today I'm emphasizing it again because it's foundational. Without this step, all the other steps will be far less effective. Step 2. Self-performed lymphatic massage. Your lymphatic system is your body's drainage system. It collects excess fluid from tissues and returns it to your bloodstream, which is blood circulation, which has your heart to pump in. Your lymphatic system depends on body movement and massage to function. When you sit a lot and move little, the lymphatic system in your legs slows down. Fluid accumulates, swelling appears. Lymphatic massage, also called lymphatic drainage, is how you actively stimulate this system. And here's the good news. You can do it yourself at home, and it only takes 5 minutes each night. The technique is simple, but direction and pressure matter. Sit comfortably with your legs extended. You'll start from the top and work your way down. This sounds counterintuitive, but there's a reason. First, use both hands to gently stroke from mid-thigh up toward your groin, where the large lymph nodes are located. 10 slow, gentle strokes. Next, move down to your knee. Stroke from your knee up to your thigh 10 times. Then move down to your lower leg. Stroke from your ankle up to your knee 10 times. Finally, work on your foot. Use your thumb to gently stroke from your toes toward your ankle 10 times on the top of the foot, 10 times on the sole. Repeat this entire sequence 3 times, about 5 minutes total. The important thing to remember, the pressure must be light. You're pressing deep into muscle. You're using just enough pressure to move the skin. Lymphatic vessels lie very close to the skin surface, and gentle touch is what stimulates them to contract and move fluid. Do this step every night before getting into bed. It jumpstarts your lymphatic system to drain fluid efficiently while you sleep. Step 3. Leg elevation and ankle pumps. This is how you harness gravity, but only for 15 to 20 minutes before sleep, not all night. Why not elevate your legs all night? Because when you keep your legs elevated for many hours, fluid from your legs rushes back to your kidneys and turns into urine. The result is you'll wake up 3-4 times a night to use the bathroom. I tried this myself, and it was one of the methods that made things worse. The one I mentioned at the beginning of this video. Instead, we use short-term leg elevation combined with ankle pump exercises. Here's how to do it. Lie on your bed and place 1 or 2 pillows under your calves so your legs are about 6 to 8 inches higher than your heart. Keep your knees slightly bent for comfort. In this position, perform ankle pump exercises. Flex your foot up, pulling your toes toward your knee. Hold for 5 seconds. Then point your foot down like pressing a gas pedal. Hold for 5 seconds. Repeat 10 to 15 times. This exercise activates your calf muscles, often called the second heart of your body. When your calf muscles contract, they squeeze the veins running through them, pushing blood and fluid back up toward your heart. Combining the elevated position with ankle pumps creates a double pumping effect. Gravity pulls fluid down toward your heart, while your calf muscles push fluid up. 15 to 20 minutes is enough to drain most of the fluid that accumulated during the day. After that, lower your legs. Move on to the next step and go to sleep normally. Step 4. Light compression socks for sleeping. This is the step many people misunderstand or skip entirely. Not all compression socks are the same. There are different pressure levels measured in millimeters of mercury. Socks rated 20 to 30 millimeters of mercury are typically prescribed for daytime, used to prevent fluid buildup. But wearing these while sleeping can be harmful. When you lie down, blood pressure rebalances, and high-pressure socks can constrict circulation, creating a tourniquet effect. The secret is using light-pressure socks, 8 to 15 millimeters of mercury, the kind often sold as flight socks or travel socks. This pressure level is gentle enough to be comfortable all night, yet strong enough to maintain the swelling reduction you achieved from the previous steps. It works as a gentle, continuous compression that prevents tissue spaces from expanding and reabsorbing fluid, while your kidneys continue processing excess fluid overnight. How you put them on matters too. Put the socks on right after performing lymphatic massage and leg elevation exercises, when your legs are at their least swollen. This locks in the swelling reduction. Check the elastic band at the top of the sock. If it leaves deep marks on your skin, it's too tight for nighttime wear. Roll the band down or choose a more comfortable pair. Pressure should be distributed evenly, not concentrated at the top. Knee-high socks are sufficient for most people. Thigh-high socks tend to slide down and cause discomfort. And here's what I want to emphasize. A good pair of compression socks costs about $15 to $25 and can last 3 to 6 months. That's one of the most cost-effective investments you can make for your circulatory health. Step 5. Foods that support edema reduction. And now the final step, the one I almost skipped during my experimentation, but turned out to make the biggest difference. Edema is often the result of an imbalance between 3 key electrolytes: sodium, potassium, and magnesium. Your kidneys, the organs responsible for managing most of your body's fluid balance, need the right ratio of these minerals to function efficiently. When you're deficient in potassium or magnesium, your cells cling to sodium and water follows. The result is the fluid accumulation we see as swelling. The good news is, you can replenish these minerals from natural foods without expensive supplements. First is magnesium. Magnesium helps relax the smooth muscle and blood vessel walls, the very veins we're trying to support. It also supports proper cellular hydration. Foods rich in magnesium that you can add to your dinner include spinach, pumpkin seeds, avocado, and bananas. A bowl of sautéed spinach or half an avocado at dinner is enough to make a difference. Next is potassium. Potassium is the primary regulator of fluid inside cells, working in direct opposition to sodium, which operates outside cells. When you increase potassium, you signal cells to release excess sodium and water. Foods rich in potassium include potatoes. One medium potato contains about 900 milligrams of potassium, more than double a banana. Spinach, avocado, and bananas are also excellent sources. Did you notice something interesting? Spinach and avocado appear on both lists. That's why I call them edema-fighting superfoods. They provide both magnesium and potassium in the same food. If you want to add a supplement, magnesium glycinate is the form that's best absorbed and least likely to cause diarrhea. A dose of 400 milligrams before bed is appropriate. This product is easy to find at most pharmacies or supplement stores, costing about $15 to $20 for a bottle that lasts 2 to 3 months. For potassium, I don't recommend high-dose supplements because they can be dangerous for your heart. Instead, get it from food. Another supplement option specifically for those with venous insufficiency is horse chestnut seed extract, an herb that has been extensively studied and proven effective at sealing capillary walls, reducing fluid leakage. The dose is 300 milligrams twice daily in a standardized extract containing 16 to 20% of the active compound eskin. This product is also easy to find and costs about $10 to $15 per bottle. Why is supplementing in the evening more effective? Because when your body enters deep sleep, it switches into repair mode. By providing these minerals and nutrients before bed, you're flooding the system with the raw materials needed for vascular recovery, right when your body is most ready to heal. To help you remember, here's the complete protocol in chronological order. From morning to 5 o'clock in the afternoon, drink 8 to 10 glasses of water, spread evenly throughout the day. At dinner, eat foods rich in magnesium and potassium, like spinach, potatoes, or avocado. Limit salt. After 5 o'clock, reduce water intake. Just sip if you're thirsty. 2 hours before bed, stop drinking water completely. 30 minutes before bed, perform 5 minutes of lymphatic massage. 15 to 20 minutes before bed, lie on your bed, elevate your legs with pillows, perform ankle pump exercises. Right before sleep, put on light compression socks, 8 to 15 millimeters of mercury. Take magnesium if you choose to supplement. Throughout the night, sleep normally with compression socks on. Do this protocol every night. Most people notice visible improvement within 3 to 5 days, significant improvement after 2 weeks, and maximum results after 4 to 6 weeks. But you must be consistent. Doing it occasionally won't work. Your body needs the repeated stimulation of nightly drainage to reset its fluid balance. Let me tell you about Margaret. Margaret is 71 years old, a retired elementary school teacher. She came to see me after suffering from leg swelling for nearly 3 years. Every evening, her ankles would swell so much she couldn't see the bones. She had to buy shoes 2 sizes larger than before, and what hurt her most, she could no longer take afternoon walks with her husband like she used to, because her legs were too heavy and painful. She had tried everything, elevating her legs on pillows every night, cutting salt so drastically her meals became bland, drinking less water because she thought that was the cause. She even bought an expensive pair of compression socks, but wearing them during the day was uncomfortable, and wearing them at night left her legs numb by morning. When I asked about her medications, she told me she was taking amlodipine for blood pressure, had been for 4 years. No one had ever mentioned that this medication could cause leg swelling. We started with 2 changes. First, I coordinated with her family doctor to switch from amlodipine to a different blood pressure medication that doesn't cause water retention. Second, I taught her the exact 5-step protocol I just shared with you. The first week she called me. Her voice was still skeptical. "Doctor, I think it might be a little better, but I'm not sure if it's just in my head." I told her to keep going. Week 3 she called again. This time her voice was completely different. "Doctor, this morning I put on my old shoes. The shoes I had put away in the closet 2 years ago because I thought I'd never fit into them again. My husband even asked if I wanted to go for an afternoon walk, and I said yes." After 6 weeks, Margaret's swelling had reduced by about 70%. Not completely. She still had slight swelling at the end of days when she stood a lot, but it no longer controlled her life. What I remember most is what she said at her final follow-up appointment. "I wish someone had told me this 3 years ago. I wasted so many afternoons sitting at home because I thought this was something I had to accept as I got older. You don't have to accept it. Margaret didn't, and neither do you." Margaret's story brings me to something I need to tell you straight. There are common prescription medications that are silently causing edema, and many doctors don't mention this side effect when they prescribe them. I'm not saying this to criticize my colleagues. I understand the reality. An average appointment is only 15 minutes. Doctors have to address multiple issues at once, and there isn't always time to go through every potential side effect. But the result is that many patients like Margaret suffer from leg swelling for years without knowing that the pill they take every morning is the cause. And here's what truly concerns me. If medication is the cause, then no amount of leg elevation, compression socks, or massage will solve it completely. You're fighting a battle you cannot win. Let me go through the most common culprits. Culprit number 1, calcium channel blockers. Amlodipine is the most common name, but there's also nifedipine and felodipine. These are very widely prescribed blood pressure medications. And here's a number you may have never heard. Amlodipine causes ankle swelling in up to 30% of users, nearly 1 in 3. The swelling is dose-dependent. The higher the dose, the worse the swelling. If you're taking one of these medications and have leg swelling, talk to your doctor about switching to a different blood pressure medication. ACE inhibitors or angiotensin receptor blockers are alternatives that typically don't cause swelling. Culprit number 2, non-steroidal anti-inflammatory drugs. Ibuprofen, naproxen, and other anti-inflammatory medications. Many people over 60 take these daily for arthritis or chronic pain. These drugs cause water retention by affecting kidney function, and they're especially problematic in older adults who often already have reduced kidney function. If you use anti-inflammatory medications regularly and have leg swelling, try stopping them for 1 to 2 weeks under your doctor's supervision. Many people see significant swelling reduction with this change alone. Alternatives include acetaminophen or topical pain relief creams. Culprit number 3, corticosteroids. Prednisone, methylprednisolone, dexamethasone. These medications cause serious water retention. They make your body hold on to sodium and water. If you're taking steroids for chronic conditions like rheumatoid arthritis or chronic obstructive pulmonary disease, discuss with your doctor whether the dose can be reduced. Sometimes doctors prescribe higher doses than necessary, and reducing the dose can significantly improve swelling. Culprit number 4, some diabetes medications, especially the thiazolidine-dione class, like pioglitazone. These medications can cause water retention and even trigger heart failure in people at risk. If you have diabetes and are taking this type of medication, ask your doctor about other options. For people over 60, a single fall can lead to broken bones, surgery, and months of being bedridden. The consequences can trigger a rapid decline in overall health. While you're applying this protocol and waiting for the swelling to improve, be extra careful. Use handrails when going up and down stairs. Wear shoes that fit properly, even if you have to buy a larger size temporarily. Clear any objects you could trip over from your floors. Don't rush when moving around. As the swelling decreases, your fall risk decreases too. But in the meantime, stay vigilant. As a cardiothoracic surgeon, I want to emphasize something that many people don't realize. Leg swelling and cardiovascular health have a two-way relationship. On one hand, chronic leg swelling can be an early sign that your heart is working too hard. When your heart pumps less efficiently, blood backs up in the veins, fluid leaks into tissues, and you see swelling in your legs, the lowest point of your body. On the other hand, prolonged venous stasis creates the perfect environment for blood clots to form, and a blood clot in your leg can travel to your lungs, causing a pulmonary embolism or put backward pressure on your heart. This is why I don't view leg swelling as just a cosmetic issue or a minor discomfort. In the operating room, I've seen too many cases that started with swollen legs that patients ignored for years. The 5-step protocol I've shared today doesn't just make your legs more comfortable. It improves venous circulation, reduces the burden on your heart, and lowers the risk of blood formation. When you perform lymphatic massage every night, when you wear compression socks, when you supplement with the right nutrients, you're protecting both your legs and your heart. That's why I took the time to make this video, because healthy legs and a healthy heart always go together. So we've covered a lot of ground today. Let me quickly summarize what you need to remember. 5 types of leg edema: gravity edema, venous insufficiency, lymphedema, medication-induced edema, and heart or kidney-related edema. Identifying which type you have is the first step to effective treatment. 5 steps in the nighttime protocol: strategic hydration, 5 minutes of lymphatic massage, leg elevation combined with ankle pumps for 15 to 20 minutes, light compression socks while sleeping, and foods rich in magnesium and potassium. Medications to review, especially calcium channel blockers like amlodipine, anti-inflammatory drugs, and corticosteroids. If medication is the cause, talk to your doctor about alternatives. And don't forget, keep your legs parallel when sleeping, and be careful about fall risk while waiting for the swelling to improve. I want you to remember this. Leg swelling is not something you have to accept as you get older. It's often the result of factors you can completely control. How you drink water, how you care for your legs each night, and sometimes just one pill that needs to be changed. Start this protocol tonight. Don't wait. Most people see improvement within 3 to 5 days if they're consistent. If this video was helpful, hit the like button right now. It helps this message reach more people who are suffering with heavy legs every day. And subscribe to the channel if you haven't. We're here every week with guidance specifically for those over 60.